Welcome back, everybody. More funding is on the way for women's health research. This week, the Biden administration announced $20 million to expand government research on women's health. Researchers say maternal health is a seriously understudied field, but in Iowa City, a team is working to change that with the help of thousands of generous Iowa women. KWWL anchor Elizabeth Kling shares their story. Take a listen.
Hidden inside the University of Iowa hospitals and clinics is a priceless bank. But instead of dollars, this bank is filled with donations from expectant moms like Michaela Keel.
I think it's really cool to know that even though I'm giving such a small thing, it's actually really contributing to the bank in a huge way.
The smallest samples from her pregnancy, frozen in test tubes and tanks,
are individual.
Could have a huge impact on countless other moms and babies yet to come.
It's just so understudied, and when you consider that it's something that literally affects every single person on the planet, it just doesn't make sense that we know so little about pregnancy.
Donna Santillan and her husband, Dr. Mark Santillan, are working to change that. For the last decade, they've been collecting the leftovers from otherwise routine prenatal tests, thanks to thousands of generous Iowa women.
We don't know what's going to happen to them in their pregnancy, and we don't approach them because they specifically have any condition. We try and ask everybody that we can get to, because you never know what's going to happen.
The biobank, also known as the Women's Health Repository, includes samples from more than 18,000 people. The samples are stored in freezers and tanks at extremely cold temperatures.
This has been a great tool to look at everything, not just focus on pregnancy, but stuff that kind of spurs from pregnancy, whether it's environmental exposures or psychiatric disorders, neurologic diseases, it doesn't matter. We're able to study those things.
The frozen samples can be used for years and re-examined as a child grows or other issues come to light.
If you find a biomarker or something that tells you that a person is at higher risk for whichever disease you're studying, it could allow you to have better interventions earlier.
Today, the bank has expanded beyond pregnancy to include issues like infertility and cancer, and it's attracting the attention of researchers from around the globe.
So we have a lot of international and national collaborators that literally just call us. I'm like, hey guys, we know you got this. How would you like to collaborate?
Collaboration thanks to the generosity of Iowa women who are banking on a brighter future for families.
They don't have any direct benefit. So what they're trying to do is trying to help the next person, trying to ask that next question with us. And for that, we'll be forever grateful. And I think that's, without them, we don't have a bank.
As a part of their work with the biobank, doctors identified a biomarker to predict preeclampsia is at just 6 weeks of pregnancy, and part of that funding the White House announced this week is specifically designed for research like that, looking for biomarkers to help with early detection and interventions.